So hello everybody, my name is Szabolcs Szeöke. It's an Hungarian name actually, and I'm working in Paderborn in a hospital as a neurosurgeon. I'm an early adopter for robotic. I brought it to you, and that's my topic today. I'm an early adopter for this technology. And the second one is I'm part of a bigger group. It's called BBT Group. So they have different facilities in different countries and in Germany. And they have the topic robotics. So not only artificial intelligence, but artificial intelligence this is the software, but where is the hardware? So we are lacking the hardware, and this is the hardware, is the robots or the possible hardware that is enforcing what we want to do or what artificial intelligence wants to do. We have a yearly summit. It's called Robotics Summit, so I'm spoiled a bit at your places. I'm sorry for that. And I'm happy to invite you to Paderborn to this summit to discuss more of these topics. So the first thing I think everybody told today, I made some notifications here, notices also from Julian, from Atos already about the why. So the why shall we take robotics into our health system? There are systems outside, I'm sorry for that. And the target is to help our employees to make better medicine, but not only in future, but now. So we have a problem. We have a problem to solve now, not in future. So robotics, also AI, artificial intelligence, is not about the future to make some fancy stuff and better medicine in future like tomorrow, but we have today things we have to solve. So I have 3 things here. The first thing, demographic. Everybody heard it, but it's a real impact. So I read 80 million people, employees, will lack in the clinical system in 2030. It's about 5 years. So it's now. We have now to try to solve this problem. The second one is the demographic Wandel in Germany. So these demographic things we will have more patients, a lot of more patients. But these patients are getting older. They are not only getting older, they're coming to me as a physician, and they want that I fix their quality of life, the quality being at home, also with 80, 90, hundreds. So we have to change in clinics with solutions like robotics to help these people and to make smarter operations, smaller incisions, help the people also if they're 80 or 90. We have to help them, and we can help them, but we have to rethink medicine and with other agents. You said artificial agents or KI agents, and for us it's the robotic, not only in the operation theater, but also in the whole ecosystem. And I think this is really important to talk about it, that we have hardware there. The second topic is regulations, like Julian also said, thank you for that. The regulations are getting harder, so it means to solve the work today is not really possible with the workforce we have. So I'm not talking about in 5 years, 18 million employees worldwide will lack in our system. But today, the nurse on the ward, me as a physician, I don't know what to do first. So because of regulations, because we have to do more documentation, yeah? And the documentation, somebody else told today, is about billing. So if I don't document, yeah, I have no documentation, then I have not done it, so I can bill it, so it's even getting worse. And documentation can help also with artificial intelligence. Society, so we are part of the society. We live in an age, I heard, like technocracy or like empire or age of science, of data. So data is the new Bitcoin, and somebody has to sort this data. So I'm not able to sort. Also in my field as a neurosurgeon specialized on spine surgery with this fancy robot, I don't know the actual data from today, probably from yesterday, to be honest, for 5 years. I try to keep up, but I don't know the newest data in South America, but the patient is coming. So this elder patient, longevity, he wants help, he wants quality of life. and he's asking, oh, I read something in the internet about this guy in South America. Oh, he's doing something with stem cells. And then it's not right to say it's bullshit because you don't know it. So also probably next door in another hospital, somebody is doing something, but I'm not up to date what his specialty is. So somebody has to help us to sort the data to our target. So 5 things today. I tried to look up Mähroboter. You know that? Who has at home a lawn mower? You say lawn mower. Nobody? Only these 3? Oh, okay. What I wanted to explain is that already in our daily life, there are robots in our daily life, and there is a lag between healthcare with all these needs, regulation, demographic things, and society data, and already the usage of robotics. So these 5 things, at first, robotics is an entity. So if you are thinking about taking this technology, it's not a product. So this guy is probably one product. I will show you some products, but it's a whole entity, and the entity, because it's an entity, it has special challenges. So second, challenges with robotics as entity. The third one is a blueprint. So who can help me? With these 2 colleagues I discussed before about the blueprint. Who can help us in the hospital to use AI? Shall I go to you, to this company, to another company? Are the system, KISS system, subsystems of KISS talking with each other? Can I extract medication from one to the other system, from the guy from the ICU to my ward? Mostly it's not possible. I have to buy an interface, and so these things I have to keep in mind, and I need a blueprint. So I think you should have a blueprint for robotics as entity in the whole ecosystem in your clinic or in healthcare. The fourth one is the deployment, something like a set card. So, I need robotics, or I can use robotics to help in my daily work, to help my employees, to empower them, how can I do it? So which product and what are the specialties for these products? And the 5th thing is then the future. Okay, robotic entity. It doesn't matter if I'm working in the operations theater. For me, it's precision, predictability, and repetition. It's what you said about artificial intelligence, Julian, about Atos. Yeah. So looking into the future. For me, I want to look in the future for you as my client, as my patient, to say, okay, I can say for 95% this will happen, and predictability. Yeah, you walk out this clinic in 7 days. Yeah, and the robotics should help me to enforce these things. Then I've written different things. It's an own entity because you can see on the robot of his design, of his construct, of the way where it is in the clinic. It's something like you showed us with the artificial intelligence. So everybody talks about robotics, but it's an own entity. It's a family. It's a family. It's a product class with a lot of different products. But for us, this is one of our partners, shows us just different way of robotics. So do you know that there are these robots outside doing jobs? They can do jobs in your hospital, help your people. So this is the different design. You see the humanoid robots. You see the guy with the rover, like on the Mars, yeah, doing tasks, automotive, driving, far away from home. You see far left a laboratory robot. And here you have different other robots like cleaning and disinfection. So there are levels that are already solved. I have a special robot for me in the OR, yes, to be precise. But you have also for the normal work on the clinic, on special departments like laboratory, automatization, disinfection, cleaning, and other tasks already robots. So here on the left, you see we do a lot of pilots, like the Plato, to help people on the ward. So pilots, because on other levels, the robotics lack to show their impact. So the Plato is, you know them from the restaurant, yeah? You go there and then it works, it's fancy, and for the kids it's fun, but in the hospital it's not working. It's the same. The robot, the Plato, should bring something from A to B to help our nurse on the ward, just like water to the patient, but he cannot open a door. So the product is nice, but it's not really working in our environment. So the other pictures is the Da Vinci and our robot here, the Mazor. This is a operation in the operations theater, a robotic arm with a navigation. So it's two systems in one. The navigation gives us, we talked about it today, a real-time information where I am, to trust the robotic that is doing something semi-automatized. So to be honest, it's not a robot. The Da Vinci, everybody is talking about it. It's not a robot at all. But it's fancy new technology that helps. So nobody wants to take out his cancer today without Da Vinci, but it's another wording. So we just have to keep in mind if we have a whole strategy for our hospital. So this looks like in the hospital, I just showed you that it's me as a surgeon is executing with the robot a task to be very precise and have a navigation that tells me that it's true what I'm doing. Why is it important? Demographic, older people. This system you see here is like keyhole operating. So to operate older people, that they are faster out of the hospital, I have to be minimal invasive. Also like Da Vinci, minimal invasive, yeah, keyhole. But you don't see what you're doing. So with the Da Vinci, you have a camera, you see inside, but for us, it's another technology. So we look from outside in the inside, and this is what technology enables us. Yeah? So no spoiling, but just to get the impact of the robot for my part, for surgical. What do you think? How precise I am as a surgeon when you come to me for help? To making my screws with this inside, because you have a broken spine, and I say I will help you, and then you ask me how precise. Do you have done this before? Oh yeah, I have it, and yeah. So not the average, but the average you want from a top surgeon, yeah, and you go to a top surgeon is about 92%. This sounds fantastic. Only 8% failure, yeah. But the 8% failure is the world for you as a patient. And to be honest, I opened the inverted commas. It's between 72% and 92%. So there is the range that I will help you. Yeah? I'm sympathetic, but probably I'm not precise. So we should use the technology that enables me as a surgeon to be precise. How precise is the robot? What do you think? You heard my talk already? Oh, fantastic. It's 99%. Yeah, we don't say 100% because nobody believes you, but since we use the robot, we have no failures of our screws. So, second, the robotic challenges. So if you say, oh, this is hot, I want a robot, not in the OR, but somewhere else, you have always the big seven, or I call it the big seven. So let's go on safari. Yeah? It's ethics, medical legal, finance, maintenance, infrastructure, communication, and cybersecurity. It means if you take the challenge to take a robot into your system, not one product, but a whole product family, like you say fleet, like a fleet, so different robots, you have these challenges and they are special for this new technology. Ethics means nobody can tell me what I have to do because I'm using the robot. Nobody can tell me on the world that I have to talk to you as a patient that I use the robot. Nobody can tell me who is in charge. So the screw is missed. I said 99%, but there is a failure. So who is in charge? So if you take robots, it's the same with artificial intelligence. You have to know these new ethical or medical legal things. Ethics is also the human interaction. You see here, it's me as a surgeon, you see the robot, and you see the patient. So there is a new interaction between the robot, the human being, robot, human being, patient, me as a surgeon. So it's a new multidisciplinary evolution we have to handle. Finance, very important for these things because you buy a very big thing, like $1 million investment, you do it to make better medicine, 2 days later, it's old stuff. It's like with artificial intelligence. So you have to keep in mind these things. Sure, I do it, but you have to talk to your company. What about the updates? Yeah. What about the maintenance? Yeah. How often do you come? And what is when the robot is not working? So everybody stands still. Infrastructure. You have to rebuild your hospital, to be honest. Yeah? The plateau, the main problem is communication with the internet, open internet, no open internet, 5G, blah, 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 and the infrastructure like moving. Yeah? In the restaurant, it's working, but in our hospital, it's not working because everything is so different. Yeah? And the communication and cybersecurity is the same. Like there are different ways like this system communicate to each other. So with your system, your patient system, the patient information system, but also one robot to the other robot. So the next one, blueprint. This is what I said, like how can you take this technology? So at first I think it's good to have a strategy. We heard today about strategy in hospitals. It's good to know for this entity, or because this technology is an entity, I need a strategy. Somebody should be in charge. So chief robotic officer. We have a lot of chief medical officers. Yo, you can do this also. I'm not sure if that's the right way, yeah? But you need somebody with different teams, OR team, nurse team, that is really enforcing the strategy. And how is he doing the strategy? With a roadmap. So who is from Frankfurt? Yeah, okay. So where are you driving? This is the public transportation system. Yeah? And you need something like a blueprint, like a transport system. We do with the Fraunhofer Institute. So we have a collaboration where we try to see interfaces like in this map. And at these interfaces, you can choose robotic and artificial intelligence solutions in your hospital, individualized. So this is on the left, your hospital environment with the different departments. And this is the clinic, the Kubus. You have the main existence of a hospital is leveled, centralized to the patient. And it means, you see there, diagnostic, therapy, and service. So the patient comes in, and then you have diagnostic, service, and therapy. And here you see these ethics, medical, legal, and finance problems that can evolve. So you have the Kubus, you have everything before the clinic and everything behind the clinic, so outside these microcosmos. And then you have these different departments. And then the patient comes in on the left side and goes out on the right side. And this is the patient journey, just as an example. Like what are you driving, S1 or in Frankfurt, you said? Okay, use it. So this is like the U1, yeah? Okay, and also the patient is always, it comes together with data, yeah? That's your topic. But where is the robot now? So the robot and all these interfaces where you see these dots, yeah? At these dots, there is a interaction, and there you can use, so this is the blueprint. For one example, the patient journey, but this is the most thing, this is our key business, the key process. So on the left, onboarding, on the right side, deboarding. This is one of the most pain in the ass in the hospital. Nobody can work if the patient is not in the system. Nobody can work with him. It's an emergency, nobody can work with him. I mean, we help them, but everything is waiting for the data. So if there would be coming a robot, yeah, with a tablet, with an artificial intelligence on it, and is decentralizing the onboarding process, he can take it, interact with your patient, and bring it somewhere. Yeah, it's like McDonald's where you tip in what you want, yeah, but on 4 terminals. And now think about this terminal will move you, and it moves you to the radiology to do some X-ray. Then it goes to the ward. Then the same robot takes the kitchen goods to you on the station. Then he brings you to the OR. He takes you from the OR, and it helps at the deboarding process. This is also very painful for us in the clinics because the patient is in a bed, and the next one is waiting for the bed. Yeah? It's like in a hotel. You know the rules. In the hospital, it's totally different. Sure, you will help the patients, but the deboarding is very important. So also think about intelligent robot comes to your patient, is friendly, helps with your luggage, and can bring you somewhere else to wait, and you can interact with him because the nurse is not there, has no time. The doctor, there is no doctor, he's in the OR, will come at 6 o'clock p.m., but the patient can take off, out of the clinic as a solution. So the same, like this U1, you have these also with goods and also with your employees and all these interfaces where you can think about these different possibilities. This is the key process: onboarding, diagnostics, therapy, care, and deboarding. Okay, so the first one, robotic deployment. So, okay, this makes sense. I have a chief robotic officer. I have a strategy for 10 years. So we begin with transportation. It's more easier and less intensive for costs than in the OR. So I have these 5 points, like a set card. So you know the communication, it's totally different from everything else. So if you have a robotic coming into your hospital, you have to communicate, very sensible. The lucky thing is the patient has no fears. He asks for this robot because it's so precise. But the employees, what do you think, my colleagues, what do they say? Who is a doctor here, a physician, and a surgeon? Okay. What, you need a robot? Yeah, okay. But you know, the communication means, I don't need that. I'm precise, 100%. I don't need this stuff. I've done this for 30 years. The nurse, I have so much to do. I don't have the time to look after this, like a second child. We had that with the Plato, yeah? They said it's a cool thing, but it takes too much time to help him, yeah? To really find into his way. So communication, communication, communication. Also like inside and outside, but you have to communicate why are you doing robotic and why. And the employees, the most thing, this was funny with the surgeon. I'm by myself, so it was funny about myself. But your employees, they fear that they lose their job. And that's reality. Not today, but like in the laboratory, it's really a pain point. The laboratory means if you don't have staff, your clinic has to close down if you don't have 24/7 laboratory. So automatization is nice, but if there is a robot, you won't replace the robot 2 years later again with somebody who is with an employee. So the workflow also for the surgeon, not nice to hear for us. You have to change your workflow. So there is this robot, wow, 99% precise. It won't change his workflow, and I cannot tell him to change, but I have to change my workflow. So it's a new philosophy, and this is also a pain point, yeah? Because I don't want to change. I do this for 20 years. That's why I'm so precise. But we have to work together. Training. You know the three secrets of French cuisine? It's butter. Second, it's butter. The third one, it's butter. Yeah? So this is not good for the health topic, but what I want to say is training, training, training. The most the most impact, the Da Vinci, that is no robot, yeah, but it has the most impact for new technologies. What do you think why? Because it's so good and it has good results. It's because of the training. The staff is sick of the training. The doctors come, I have to fly to Helsinki the 3rd time now, yeah? But it's so clever and so good, so if you have this new technology and you really know how it works, then you have the impact. But you will totally fail, yeah? I know from my clinic, like navigation. Wow, navigation will help you. But if you don't know how to use it, you say, this is not working. The truth is, I'm the failure, yeah? But I say to this technique, it's a bad technique, and the technique is in the site, and nobody uses this, but it could be helpful. So training, and this is also for the companies, is very important. Infrastructure. The biggest problem of the robotic is changing the floor, going through a door and changing like with the elevator. So the infrastructure, if you take robotics inside, you have to think about it in 2 things. The building infrastructure physically, And on the other side, the technology like communication, virus LAN, da, da, da. So every robot needs some connection to the system, not only for patient data, but to know where it is, so for geolocalization, yeah, for mapping. And the last one, failure culture. The robot, 99%. Thank you for the trust. It's right. But this means you have to implement for robotics a new failure culture, because I am the one who's making the failure in 99% if something fails, and the team. This is not nice for the team. It's not good. It's important for communication because it's really hard. We had that also in the beginning. Oh, the robot has done this, the robot has done that, and then we analyzed it with the company, and it always was a failure of mishandling. So probably we had not enough training. Yeah? But that's really a hard point. Failure culture and new failure culture. On the other side, the 1%, I mean it's more, but the 1% for the patient is changing everything. So if you have a failure, you have a fatal failure. You have a systematic error. It means all screws are probably wrong. So I hope this will never happen. But then you need to have a plan to overcome these, not only in communication, but to have a plan how to succeed. Yeah. And also, like failure culture, if the robot is not working, who's doing the work? Yeah? So I think a mix is good. So last but not least, robotic future. Today, I'm not sure if you know that, we are already here. So we have solutions, and that's where we are going, is here. It's like a really humanoid, but it doesn't have to be a humanoid, but a robot that really autonomously is doing work for us and helping in everyday work. Future robotic, it's a multi-application platform. So my colleague from Nokia, yeah, sorry for that now, the iPhone, yeah, it's a multi-application platform, yeah, because it's no more phoning, it's no more phone calls, it's a multi-application form. And this is the same for the robots. Here is one example. It means you have also, because for investments, you have one robotic entity. I mean, not the whole family, but you have one family for transportation. And then you have add-ons, like modular system, and they do all different transportation. You have different levels of transportation. It's a difference transport a good in the keller, down, or in the normal public area, or with a patient. Yeah, the highest level, autonomous driving a patient into the OR, or even one level more, bringing out of the OR when you are still in narcosis. So this is, I think, the future, to create a robot, like a modular system. And this is my last slide. It's a multi-application platform. So I think the next evolution, it's like AI. It means you have the AI central talking to the robots. Oh, please go to the onboarding process. Oh, robot B, go to the deboarding process. And the robot itself is melted with an artificial intelligence and has a second tablet where you have multi-application apps, yeah, like entertainment or rehabilitation or prevention or things like that. And this is the future. We have pilots with that, but this will be the future robotic hardware helping in our environment for better medicine. So thank you very much for letting me talking here. And then here is my LinkedIn account, and there is the Robotics Summit. And I would be happy to see you in the Metropole Paderborn. It's a small city, but you can reach it with flight. Yeah? Thank you very much.